Well, hello, everyone. Welcome to the first of our fall virtual series, The Role of Context and Implementation of Evidence-Informed Programs and Practices. We are so glad that you're all here. So given the large number of participants, all of your phone lines are muted and your videos are not enabled. So you get to relax. You don't have to be on camera and listen and enjoy. However, the chat is live and we really encourage you to use it as you've already done. We're excited to see the chat light up with people welcome each other and letting us know where you're from. We are hoping that you will share your questions and ideas in the chat so that we can be as interactive as possible in this virtual format. This session will be recorded and will be posted on our website. So don't worry about taking notes, or if you want to share it with other people, it will be posted. And we do have a quick evaluation at the end, and we hope that you'll take a few minutes and complete that for us. So this is a little snapshot, so you can see who else is with us in our virtual room today. Noticing as our participant numbers increasing and grow every minute. So we're up to 263 people now. So if you just are looking at this slide, this gives you a feel for the different type of work that people are doing of the people that registered. And we have a really diverse perspective of folks that are with us. We also have people with a range of experience. Whether you're newer in your career, having worked 1 to 5 years, or you've been at this for a while, over 15 years, we have a nice spread there. And if you look at the different agencies that are represented, we definitely have a lot of folks in higher education and who work in nonprofit and in state government, but also have lots of other perspectives as well. And we're so glad that you're all here. We have a lot of countries that are represented according to our registration, and well, most of us are from the United States. As you can see, we have many countries represented. I think at least 15 other countries that are here. So from all those different time zones, it's so exciting that you are joining us. And also we looked at their racial and ethnic identity, and as you can see, currently, we are not as diverse a field as we need to be when it comes to working in this space. And we're hopeful as we go forward that we can think about ways that we can really invite and encourage and make space for lots of other voices to join us in our work. So we wanted to do a little quick warm up. So for some check-ins, so we're gonna launch our first poll. So this is the question. So if your work life were the weather, how would you describe it right now? So your options are sunny and calm, breezy and cloudy, it's raining and cold, or it's a hurricane and a tornado. So if we could have the poll launched while you're thinking about your answer.
Trying to launch that poll now. Thank you for your patience. It's I'm not sure if we have to reset that poll. It's wanting me to be able to share the results, but I haven't actually issued the poll yet. Oh, relaunch. Here we go. Thank y'all for your patience.
Technology warm up, everybody. Here comes the poll. Maybe.
I can see the poll.
Okay, I can't see the poll, but that's okay. Todd, I'm gonna let you take, Allison, can you help the poll since my Zoom needs to be fancier than it is?
We've got about 230 responses in, still getting a few more. Oh, this is great.
This is very suspenseful, Todd. We're gonna see how everyone's really doing today.
I'm seeing the results come in real time and I'm excited.
We don't have to recount them.
Okay.
Oops, did I say that?
I'll go. I'll go ahead and end the poll there, and then I will share the results. Everyone see those?
Oh, all right.
I cannot see them. So Todd, would you mind illustrating? Who is the winner?
Breezy and cloudy, 47%. Followed by raining and cold at 22%. But then very close to that, 19% sunny and calm.
Excellent.
And unfortunately, we do have about 12% coming in as hurricane and tornado.
Whew.
So those 30 folks who are hurricane and tornado, we are so grateful that you're on, that you made space for us today, and we will do our very best to get you to calmer weather by the end of this webinar.
Exactly. Thank you. And then let's just try one more quick one now that we've got this sorted out. So how many hours a day do you average on Zoom or Zoom-like platforms? 0, and if you are a 0, I'm very envious. 1 to 3 hours, 4 to 6, 7 to 8, or you've given up counting. And I think this is a question as we're starting to warm up our brains to think about context, because the context in which we're all working right now is really quite different. So let us know how that is.
Just over 200 responses, 230.
I love it. This is a wonderful active group.
Very much so, 250.
Nice.
Unfortunately, I think I know what these results are going to be, Todd, but we'll see.
Are we going to predict?
I think we're going to predict that it's not going to be good.
I'm going to go ahead and end the poll. We got 253 responses. Let's go ahead and share the results. Did those pop up for you now, Sarah?
Nope. I think it's
all right. Well, 51%, 4 to 6 hours on average a day on Zoom. Wow. Followed by 32% at 1 to 3 hours. And then we have about 8% saying they spend about 7 to 8 hours a day. Another 8% said they've given up counting. That's fair. And then just 1% or 2 individuals said 0 hours on average a day.
Well, we're going to
you're on Zoom now. We caught you.
I was going to say we're going to break their average now.
Sorry about that. Awesome. Well, thank you everyone for checking in with us, and as we try to connect with each other in this virtual space. And one other way that we are hoping that we can connect is through social media. So this is our hashtag for the next hour and a half, hashtag UNCImpSci2020. If you see, Todd Jensen has made that his image, and we'll be putting it in the chat from different times. So if there's something that really strikes you as a great idea or something that you want to reflect on or share, please go ahead and tweet that so we can keep this conversation going. So our objectives for our time together. So first, we're going to provide a live demonstration of Scotland's digital resource called Early Intervention Framework for Children and Young People's Mental Health and Mental Well-Being. It's designed to support service providers in making fully informed decisions about interventions that are implementable and sustainable for their specific context. And then we will discuss the integration of racial equity considerations into an assessment of contextual fit and feasibility, the Hexagon tool and discussion guide as developed by the National Implementation Research Network. And this reminds me that I didn't introduce myself. I'm Sarah Verbeest. It's nice to meet all of you. I am the director of the Jordan Institute for Families at the School of Social Work at the University of North Carolina at Chapel Hill. So the run-up show for the morning, welcome and stage setting. And then, as I mentioned, we're going to have an overview and live demonstration of the framework that I mentioned. In between, we're going to have some facilitated chat, questions answered, and discussion. Then we're going to talk about centering equity when selecting interventions. We will then move to an introduction to the revised Hexagon tool and discussion guide, and then give you a preview for what's ahead in our series. And with that, I am going to turn it over to my friend and colleague, Allison Metz.
Thank you so much, Sarah. That was funny that you forgot to introduce yourself. I think it's when we're in the prep mode for so long, we're so used to seeing each other that we forget that there's like 300 more people on. I love that. That's so great. So I'm Allison Metz, and Sarah and I co-chair the Institute for Implementation Science at UNC, which is started off as a summer institute event a couple years ago. But with the pandemic, we have moved to a series of virtual sessions. We had one in June, and as Sarah mentioned, this is our first one this fall, and we'll be previewing some additional ones that we have just coming up right around the corner. I'm also the director of the National Implementation Research Network. We are joined by some amazing colleagues this morning that will be doing some presenting with us and helping to moderate the event. So we're joined by Christine Andrews, who is the Director of Youth Development at Child Trends, Laura Lewison, who is an Associate Director with the National Implementation Research Network. As Sarah has already introduced herself, I also wanted to mention Todd Jensen, who's on faculty at the School of Social Work and a family engagement specialist at the Jordan Institute for Families with Sarah. And you'll see him kind of pop in and out. He is critical for this event. So happy to have Todd with us as well. And I'm going to do an introduction a little bit deeper for our first presenters, Marita Brack and Judy Thompson, who are part of National Health Services Education for Scotland. And what that is, the acronym is NESS, and NESS is responsible for the training of healthcare disciplines for the National Health Services in Scotland. We are so lucky to have them with us today. Judy is a trained clinical psychologist at the University of Edinburgh and has over 30 years of experience as a clinical psychologist. She works clinically with children and young people's mental health and learning disability services. She is currently the Director of Training for Psychology Services at NESS and has a longstanding commitment to early intervention and evidence-based psychological interventions, and in recent years has been exploring the potential of ideas from implementation science to maximize impact for education and training. And we have also, as I noted, Marita Brack, who is a clinical psychologist and head of program for the Parenting and Infant Mental Health workstream within National Health Services Education for Scotland. Marita is also a clinical psychologist. For 15 years, has worked in specialist services for children and young people, both in Scotland and Australia. And she has a long-standing interest in early years, early intervention, and evidence-based parenting interventions. So as we move forward, I just wanted to note how exciting it is to have Judy and Marita here with us today. The resource that they're going to share is truly exemplary, I think one of a kind. In the US, you'll know, and I think around the world, there's lots of registries for effective programs. So we might call them What Works clearinghouses or registries of evidence-based programs. And we know that many of those registries lead with research evidence and rate programs according to their level of research evidence, which of course is an important factor in selecting interventions. But Marita and Judy and NESS were really committed to not only leading with research evidence, but really centering the idea of contextual fit within the resource itself. So to be able to really help service providers in Scotland make informed choices about the interventions that they select and to make sure that they would be relevant for the populations that they work in the range of communities in Scotland. And I really think that what they've done here is something that's a model for what these registries can look like. So we're just so thrilled to have them here. They're going to share the resource. They're going to do a live demonstration of it. And then we'll have some time for Q&A. So with that, I am going to turn it over to Marita, who's going to take us through their journey and the choices that they've made to have this intervention and then do that live demo. So Marita.
Thanks so much, Alison, and thank you for this opportunity for us to share this resource with you all, because we're really excited to be able to showcase it today. What I wanted to start with was just some background information about how this development came about. And mental health, including children and young people's mental health, has been a high priority in Scotland for quite some time. And the commitment to supporting mental health has really been strengthened by some of the research that's come out in recent years. So we know that there's research demonstrating that many adults who experience mental health problems actually develop those mental health difficulties during their childhood. And we have research that shows the positive impact that early intervention can have on mental health, as well as the evidence around the cost effectiveness of early intervention and prevention being recognised. However, despite this research and the investment that there's been in mental health, the prevalence of mental health problems in Scotland, and including the mental health problems in children and young people, is still high. And recent years have seen really worryingly long waiting times for children and young people to be seen by specialist mental health services in Scotland. And there's just the growing reality that these specialist services can't meet all of the needs in terms of the children and young people's mental health. We've also had an awareness that there's been very little effective early intervention and prevention for mental health difficulties being delivered in Scotland, and certainly that what is being delivered is not necessarily being delivered at a scale that's likely to have a population impact. And so in response to this, the Scottish Government made an action in the current mental health strategy to develop a resource to help services make better and increased investment in prevention and early intervention. And the aim of this would be that this would increase the actual delivery of prevention and early intervention programs that were being delivered for children and young people, and hopefully reduce the need for these children and young people to have treatment through specialist services. But ultimately, the aim is to improve the mental health of children and young people across Scotland. And NESS was commissioned by Scottish Government to partner with them to develop the resource to support those ambitions. In Scotland, for a long time, there's been a strong commitment to the delivery of evidence-based interventions, including the delivery of evidence-based mental health interventions. But what we know is that just selecting evidence-based interventions is only one element in terms of improving the mental health outcomes of the population. We've become increasingly aware about implementation factors and how they impact upon the success of an intervention in a community, and ultimately whether the health outcomes of those communities are improved. We're aware about that there's a prevalence of what works registers already in existence. And so what we were very mindful of was that we needed to be clear about what added value any resource that we developed would be adding. Certainly what we wanted to make sure was that there was an implementation focus to the work that we were doing, and there was a real priority that it was developed with the Scottish context specifically in mind, because the overall ambition is that it supports the investment decisions that are made by local services, and that those local services are making decisions bearing in mind the local context. And any decision has to be informed by the population whose needs that they're trying to address. In terms of the context of Scotland, in terms of health and health inequalities and inequity, pleasingly overall, health has improved across Scotland over the last 50 years. However, there still exists significant disparities in terms of the health outcomes, and health inequalities remains a significant and long-standing problem within Scotland. And trying to reduce these inequalities is a real ambition of the Scottish Government. There are two particular areas of focus in Scotland in relation to the inequalities and inequity that I wanted to lift up today. And they're in relation to the impact of deprivation and rurality on health outcomes. Deprivation is not just about poverty. So within Scotland, we use what is called the Scottish Index of Multiple Deprivation, and it's a validated measure of multiple factors of deprivation that's derived from the postcode, so the areas where people live. And deprivation is calculated across many indicators that fall into 7 domains. And they include income, employment, housing, health, education, crime, and access to services. What we know in terms of deprivation is that there's huge variations across the country. And if we look at the overall national picture, on average, 40% of the population live within the bands 1 and 2, which are the most deprived areas across the country. So that there's 5 bands, and bands 1 and 2 are indicate the most severe levels of deprivation. However, at a national level, that average, that's 40% of the population. In our most deprived areas, this can be as high as 66% of their population live in those bands 1 and 2 high levels of deprivation. And conversely, in our least deprived areas, this can be as low as 10 to 13% of the population. So you can see that there's huge variation in terms of the deprivation that there are across the country. And deprivation has a big impact in terms of morbidity and mortality. And the burden of disease in the most deprived areas of Scotland is more than double that than it's found in the least deprived areas. And in terms of life expectancy, what we know is that there's great variation between the most affluent and the least affluent parts of the country. And to use Glasgow as an example, which is the most populated city in Scotland, what you have is that in a recent study of different parts of the city, you had a 14.3-year life expectancy difference for males living in one of the more deprived parts of the city compared to males living in one of the more affluent parts of the city. And for females, it was 11.7 years difference in life expectancy, despite these being areas that are geographically only 6 miles apart. So, you know, deprivation has a huge impact on both quality of life, quality of health, but also how long someone's life expectancy is. In terms of rurality, there's big impacts that we need to consider in terms of that as well. So rural Scotland accounts for over 90% of the land mass, yet only 17% of the population of Scotland actually live in rural areas. And there's differences in terms of who we have living in rural areas. So rural areas tend to be populated by an older population. And along with that comes the health issues related to ageing, as well as those related not specifically to their health, but in terms of their ability to access health. So in terms of their ability to drive, in terms of their ability to be working, in terms of their sort of social connectedness with others. One of the other important factors is that rurality masks deprivation. So as I mentioned, there's the Scottish Index of Multiple Deprivation, but unfortunately it as a measure is not sufficiently precise or sensitive when it comes to rural areas. So typically rural areas will look like they have less levels of deprivation than might be experienced by particular families within those communities. Understandably, access to services is poorer in rural communities than it is within more urban settings. And that's both in terms of things like health, but also transport. So that the amount of public transport that is available within a rural community is vastly different than it is within a major city, but also just the other offers that are available. So the other, you know, non-specialist, non-health services that are available in terms of impacting on mental health, they're obviously far fewer than you would expect in more populous parts of the country. Distances to travel, the more remote parts of the country often have quite lengthy distances to travel to be able to access even something like a GP. So, you know, it's not about getting to a hospital per se, but being able to take advantage of just really primary care level health is more of a challenge as well. There's also difficulty in terms of staff. Attracting and retaining staff is a challenge. And in terms of things just like general practitioners, what remote and rural services have to rely on is expensive locums who come for a time but then move on. In terms of mental health, stigma is a real difficulty within rural communities, and people have concerns about people being aware of what's going on in their family, people knowing their business. And so they're real issues that we have to think about within that context as well. the communities in some parts of the country are actually just too small to support some programs. So there's just not a large enough population to actually make it worthwhile to invest in certain programs or interventions. And unfortunately, you know, despite all the sort of success that we've experienced this year in terms of moving to digital technology, actually that is not the answer to everything in rural communities, because unfortunately in many parts of the country, internet access still remains quite poor. And so digital is not the complete answer when we're thinking about that, the remote and rural context. So you can see that contextualizing the decision-making process around what we invest in is really critical, not just for Scotland, but obviously for other parts of the world as well. And so finding a good match between an intervention and the local context has the opportunity to not only improve the outcomes, but also address some of those disparities that I've been speaking about, and hopefully also advance equity. So the ambition was that we would be developing a resource that provided the information to help services make those best possible choices for addressing not just the outcomes, but also addressing issues around equity. And we wanted to balance decisions about evidence and research with those implementation considerations. So we wanted things like the needs, values, priorities, and resources within communities to be getting just as much consideration as the evidence that there is around particular programs. So with that ambition in mind, we looked at the hexagon tool. So this was something that we were somewhat familiar with, but then looking at it further, we saw that it really mapped onto the sort of dimensions that we were hoping to capture in the resource. And the decision was taken that the 6 dimensions of the hexagon would actually underpin the resource that we developed. So like you would find in other What Works clearinghouses, we wanted to have core information about programs and what are the core elements of it. And also obviously to still include evidence about the what research there is in relation to particular programs, but we wanted to extend beyond that. And this is where the dimensions of the hexagon really come in. So what we wanted to think about was including the information for those program related dimensions, but also having information and guided questioning so that areas could really engage with what were the considerations that were pertinent to them at the local level. And with permission from Alison and Laura and the team at NERN, we were able to make adaptations to the hexagon for our purposes. So if you look, Alison will show the picture of the hexagon. For those of you who are familiar with the hexagon, the way that we've set it up for our purposes has meant that we've done some adjustments here. So the order of the indicators is different to how the hexagon looks now. We also spent quite a lot of time looking at the questions that we were asking within each of those dimensions and how we were going to score those dimensions. So what was going to be the distinguishing markers between the different levels of scores that you could get. And as you can see, our graphic looks slightly different to the new version as well. But, you know, we were delighted to have found such a model that we could base our work around. You can also see from the picture of the hexagon that what we wanted to move away from was evidence being the first thing that you came across. So you can see actually that at the top of the hexagon, we don't have evidence there. And that was a really sort of critical decision that we took, that if we were doing this to start getting to people to think about implementation considerations, what we needed to do was to move away from just defaulting to evidence as the sort of top priority. So in terms of developing the resource, we've taken a phased approach, and the 4 phases that we've been working through have just related to the different age ranges that the resource applies to. So the resource starts from the antenatal period and will go up to age 18 years. Initially, we had 3 stakeholder groups that all had distinct roles. However, having had a couple of joint meetings between 2 of those stakeholder groups, we really felt that those were really successful meetings where we were all joined up. And so the decision was taken that we merged 2 of those stakeholder groups, that they could come together in the future as just one. And that has been a really helpful decision and has really sort of powered the work going forward. One of the things that was really important to us was that we had good representation across sectors. So we've got, you know, people on our stakeholder groups from health, social care, education, but also the voluntary sector. And we've been able to rotate the people involved. So as we move through the different phases, we've had a change in personnel of who've been in the stakeholder groups to really reflect the sort of experience and expertise of the members that are most pertinent to that stage of the development. And I think one of the things that's been really important and has worked extremely well has been that we've taken a real collaborative process with the development of the resource, and that's included establishing which actual interventions we include in the resource, and that has become more streamlined over time, but we've always engaged our stakeholders with that using a multi-round Delphi process, which has been really helpful and has really broadened the scope of what has been included in the resource. In terms of developing the content, the program reviews, and I'll talk you through those so you can see the actual content in a moment. They've been undertaken by colleagues of mine within NES, but also other colleagues that we've commissioned to contribute to the work. And all of the programs have been scored independently by 2 raters, and then we've ratified those scorings. What was been very pleasing has been that we've had really high levels of inter-rater reliability and good discriminant validity across the program. So we've not ended up with a situation where all the programs ended up being scored in slightly similar way. Actually, we've had you know, lower scoring programs and higher scoring programs as well. And I really feel that the time that we took to establish the questions and the scoring criteria on the hexagon for our purposes was really time well spent, because that has really enhanced the reliability and the validity of the resource that we've developed. And we've shared the ratings that we've had for programs with stakeholders, so people who are familiar with the programs, to get feedback. And pleasingly, we've had really strong agreement with the ratings by those stakeholders, which is great. One of the things that we're progressing is about engaging those with lived experience to gather feedback about the resource from those people. And we've had preliminary discussions with our stakeholder group, and we've got further discussions planned for next week about how we're going to do that in a really meaningful and purposeful way. So this is the early intervention framework, and I'll be taking you through a demonstration of the resource in a moment. And through that demonstration, what I'm hoping you'll be able to see is how to search through the resource and the various levels of information that's contained within it, the different functions of the resource, including how to do a self-assessment, how to score the programs, and how to compare the programs. I thought that it would be helpful to use a case study to illustrate how a service commissioner may go about using the resource. And so I'm going to draw upon some of the elements that I was talking about as being particularly relevant in terms of context. And so I'm going to base a case study on a remote and rural location. So thinking of a location that would include small island communities. And I've decided that the focus that we're going to be looking at is around supporting infant mental health. So we're looking for an infant mental health program, which is specifically focusing around enhancing the parent-child relationship. Now, because we're in a very small community, we don't have a specialist team. So we're going to be looking for programs that don't need to be supported by really specialist personnel. And although we, have a small community, some of those community members are highly vulnerable families. So families living with additional needs, families living with, high levels of deprivation. So we want to be thinking about that. But we're also needing to be aware about stigma, about accessing mental health services. So something like a universal offer that could be available to all families, but that also has some relevance for families with additional need would be the sort of thing that we'd be looking for. And because of issues around digital accessibility, what we wouldn't be looking for would be an online program. We'd be looking for something that would be able to be delivered in a face-to-face setting. So I'm going to, Alison, if we could, I'm going to share. Now, I'm hoping that you can see the screen. So this is the early intervention framework, and I'm going to just run through a bit of a demonstration for you. So this is the landing page, and you can see that there's some information on that about how to use the resource, some background information about the development of the resource, but also exploring the programs. What I'll do is go straight into exploring the programs, and there's two ways that you could get in there. You can either go into search programs, or you can go into the explore the program box. So we'll start there. Okay. Now at this stage, what I wouldn't be looking for is to search by name of a particular program. I want to keep my options open. So I won't be including that. What I will be looking though is to focus on the target age. So I'm going to filter by the target age. I'm not going to filter by programs that are only implemented, have been implemented in Scotland at this stage, but I'll look for programs that have been delivered at an individual level and that are universal. And in terms of, you can see that you can search under the mental health and wellbeing need that you're focused on. And so I'm going to focus on supportive, positive relationships. And so the parent-child relationship and attachment. What you could do is then to filter by scores that the programs have received on the usability, supports or evidence dimensions. If you were after ones that had met a certain level of criteria. I'm not going to do that at this stage because I'm wanting to open up my search as widely as possible. So once we're happy with what filters we're using, we'll hit search, and you can see that we've come up with 9 results. So there's 9 different programs or approaches that meet those criteria. Now looking through, there's a couple of programs that I'm familiar with, so I'm going to start with those and walk through how you'd look through the programs. So I'm going to start here with the PEEP Learning Together program, and if I click on View Program, it will take me into the PEEP program. So what you can see, and this is the same for all of the programs, is it starts off with a bit of a program summary. And so that's a good place to start, as a bit of a scan. So you can see whether this actually is the sort of program that you're looking for. And so I can see that, this is a program that's talking about that it's universal, but it can be targeted for families with sort of high levels of need. So that's sounding good to me. And that it's delivered individually. So again, these are the sorts of things that were of interest to me. So that's sounding like a promising program. What you can see over to the left is that we've got the dimensions of the hexagon. And what you'll see is that usability, supports and evidence, they've got scores on them. So what you can do is open up these, and then you get taken into the detailed information about each of those components. So within usability, we can see that that's been scored as having a rating of 3. And if you hover over the question mark, it tells you what a score of 3 means. So a score of 3 on usability means that it's somewhat usable. So this is an intervention that's got operationalized principles and values and core components that are measurable and observable. It doesn't have a fidelity resource, so it doesn't have something to assess fidelity, and it hasn't outlined specific modifiable components. So that's why that one's received a score of 3. But what you can see is that there's a lot of detail here. So it gives you the detail around what are the core components of this program. And then it does outline what are the modifiable components. So whilst it might not have specific details about that, what this program says is that, that there's lots of elements that can be used flexibly. And it also has the information about fidelity, how they're achieving fidelity with that program. And similarly, if we go into supports, again, it has a rating there, and it has a rating of 3, and that translates to mean that it's somewhat supported. So some resources are available to support competency development or organisational development, but not necessarily both. But what we've got here is the detail around the implementation support. So it tells you what PEEP as a program will do. So it talks about that it's got training. It talks about that it will have conversations with services who are interested in using the program. And it also talks about that sites can have a training and support agreement where you develop local trainers. So that would be something for me to think about in terms of sustainability. It doesn't require a license.
Marita?
Yes,
Marita, this is
Alison.
Allison. I'm so sorry. I don't know if it's possible for you to zoom in a little bit more on your screen. We have some folks who are just asking to have like a little bit of a closer look.
Yep.
Yeah, that's fantastic. Thank you. And so sorry to interrupt. We're getting a lot of wonderful feedback at how amazing the resource is, Marita and Judy.
Oh, no problem.
So I think folks really want to get an up close on it. Thank you so much.
So this is just some more details that it includes in there. So it's got information about costs involved, but it's also got information about the staff competency. So not just thinking about organisationally what you would need to do, but about the staff who would need to be involved. And so here it talks about what qualifications people need to be at. This won't mean anything to people outside of Scotland, but an SCQF 6 is basically that someone has a high school certificate, so that they've got that high school level qualification. And it also talks about the training and what that involves. So we can know about that and what supervision requirements there are as well. And as I mentioned, obviously evidence is still included, but what we wanted to do was to not lead with evidence. But here, if you look at this, it tells you what a score of evidence means. And so it's got a score of 4. So it's had demonstrated evidence of effectiveness based on one rigorous research study, and it's demonstrated that there's been child mental health outcomes from that. And so within the evidence section, what we've got is information about the theory of change. So what's the model that the program's based on. And then you'll see that there's 2 different sections here. So I would be looking at the evidence rating in relation to infants and toddlers, because that's who I'm interested in. But if you're interested in the program for slightly older children, you would look at the evidence for that section. So just looking at the infants and toddlers section, it talks about the research studies that have been undertaken for this particular program. And here we can see that those outcomes that they talked about. So we've got improved self-esteem for children, got for parents, there's improvements in parents' self-reported view of their parent-child interaction. So there's two things that we can do now. So that they're the program indicators. And the next step would be to look at the implementing site indicators. So we've got fit, capacity, need. Now what you can do is that you can just move around the hexagon just there and look at what are the considerations and what are the things that you need to be thinking about in relation to those dimensions. Or if you wanted to take a more formal dive into it, what you could do is complete an assessment. And so I'm just going to talk you through that. So you would click on this complete assessment button. So I'm just going to take you to this. So this is what, just increase that one for people again. So this is what a self-assessment for that particular program would look like. And so you would move your way around each of those. And as you can see, so it asks questions related within each of those dimensions. So I'm starting off in fit, and there's specific questions that are for that program. So overall, there are similar questions for fit, capacity and need, regardless of what program you're going to be looking at. But within each program, they've been tweaked slightly so that they're specific and highly relevant to that particular program based on the information that we've got about the program. So in terms of values, it says PEEP is guided by principles of empowerment and self-efficacy as strength-based, relationship-focused intervention. So does working in a strength-based approach align with the values of your service? Now, not all of the programs are going to have that question asked because they're going to be based around different values and different priorities. But for each of the programs, they have been, the questioning has been made bespoke so that it's highly relevant to that. So what we've got within FIT, we've got questions about the values, we've got questions about the priorities, and also questions about existing initiatives. Because one of the things that we don't want to encourage is if there's already, you know, well-developed, well-implemented programs happening that basically do the same job, we wouldn't want services to be going, okay, we're going to stop doing that and start doing this necessarily. So, so it's really important that services are thinking about what already exists. And similarly for capacity, again, there's a series of questions that overall are the same, you know, across programs, but have been tweaked to drill down into the particularly relevant elements for this particular program. So the capacity questions ask around workforce, they ask around technology support, and they also ask around administrative support and financial supports. Sorry, what I should have said for both of the capacity and fit is that then you can score these. So these are ones that are not scored beforehand. These are ones that you as a service would make a decision around. And so what you'll hopefully be able to see is that if you hover over the question mark here, it tells you what the different scores mean. So 1 means that you would have no capacity, 2, you'd have minimal capacity, 3, you'd have some capacity. And so then you pick what is relevant, the most relevant score for you, and you just add that in there. And then similarly, you would go through that for the need dimension. So looking at a comparable population, what's the desired outcome? And then again, looking at how well does this program meet the needs of what you have within your local community. So it's very specific to what you're needing to focus on it and who your priority population is within your local area. So once you've gone through and scored the program, there's a couple of things that you can do. You can either save that self-assessment, and that then will get, you'll get sent a link in your email. So if you wanted to come back to it, you just have to click on that link, or you can generate a self-assessment report. And I'll show you. So a self-assessment report, I'm not sure how clearly this will show up for you, but a self-assessment report has all of the sort of background information, and then the program summary. It will include all of the program indicators, so all that information that we saw earlier, but it will also include, importantly, the answers that you've put in. So it'll include the score that you put in about a particular program in your own context, but also the responses, so you could share that with others. And another feature that that we have is that you can compare programs. So if you were looking at a couple of programs, you can then include them to be compared. And then if you had, let me just get that up, sorry. So if you had numerous programs, they would just, so you can compare up to 5 programs, and they would be lined up side by side with, so you could see their scores across the different programs. What I'd want to point out is that what the early intervention framework and the self-assessment doesn't do, it doesn't tell you what program you should go with. So there could be reasons that you have one program that scores slightly lower than another one, and there might be really valid local reasons why you might go with that one. So what this is really a tool for is to help guide decision making and help people to really systematically work through some of the considerations that they need to be making before they make any sort of investment in any sort of program. But it's not the sort of resource where it will tell you, well, you know, clearly this is the one that you should go with. It's really just a tool to assist in that decision making, rather than telling you what you actually should be doing. I appreciate that was quite a quick run through, but I'm going to pass back to Christine, who I think is going to help us with some Q&A around the resource.
Hi, thank you, Marita. Can everyone hear me okay? Give me a thumbs up. Okay, great. Well, we've gotten a lot of great feedback in the chat of people really enjoying this tool and anxious to get their hands on it. So thank you for putting the link in the box. I know people are probably navigating it on their own. Thank you for sharing. I did have a couple of questions that I'm hoping we can have you respond to that's come up. So very early in your presentation, you were talking about deprivation. And one of the questions that came in was wanting to know, how did you calculate deprivation, and wanting to understand if you used a composite score approach, or what was your methodology in calculating deprivation?
I should say that I didn't calculate deprivation. So that is something that is done, and it's just a published publication about the Scottish Index of Multiple Deprivation. So every postcode in Scotland is assessed on those 7 dimensions of deprivation, and they are given a rating. So they fall into category somewhere between 1 and 5, and that gets reviewed regularly. So areas can move higher or lower in deprivation, and so it's not something that we were involved in. That's just national publication that's done by the government, but it's one of the measures that's used in terms of helping local areas decide about you know, what resources and what demographic there is within their different areas within their wider locality, to think about what services and supports are really needed there.
And just to jump in, it's Judy here to say that I think in the US, it's a postcode is the same thing as a zip code. I think you call it a zip code.
Yes.
So it's every house and every street has got a postcode, and in a village would share the first few numbers of a postcode. So there would be a deprivation category for that village. Does that help?
Mm-hmm.
Yes, thank you for that. The next question was about your selection of the tool. How did you select the hexagon tool? Were you considering other tools? What was that decision-making process like?
Well, we had some friendly American colleagues that we had prior knowledge and experience of working with, and I think it would be fair to say there was some influence there. Yeah.
Yeah, I'll just note that so NERN has had an incredible partnership with Education for Scotland, and had introduced the hexagon tool at an event. I think this is, Judy, I think it was 3 or 4 years ago. And then the ministry had this desire to have this digital resource. And there was just long conversations about, as Marita was describing through the presentation, about knowing that research evidence matters, but wanting to lead with context and really wanting to think about what would be a good fit for a range of Scottish communities and also a range of populations. And as Marita said, they used that hexagon tool, but also adapted it for this. And I just want to say it was one of the things that was challenging about it is you can score the program indicators ahead of time, as Marita showed, because they're kind of inherent to the program. But figuring out how to deal with the implementing site indicators, the capacity, fit, and need, because you can't pre-populate those, because an implementing site has to decide, do we have the capacity? Is this a good fit? Does it meet our need? And so just kind of figuring out how to make that all work. And we were just very committed to being able to hover over each slice of the hexagon. That was Marita and I's main goal, was to be able to do that and share information. So Marita, that was very satisfying when you were hovering over each of them.
I know, I wanted to hover, Alison. We were obsessed with it.
We were obsessed with finding a contractor that could do that hover function. That's an aside. But anyway, it was a long journey.
Okay, we have a couple of more questions in the Q&A and in the chat, but in interest of time, I wanted to pop in one specific question about centering equity, because that's really going to transition as well to our next speaker. So the question that we're posing to the group for the participants to respond to, and this is something that you can respond using chat since you're all muted. I will read out your responses in the chat box. But the question we have for you is, how can we center equity when we are when selecting interventions? And so when you're thinking about centering equity, you can probably be thinking just about those dimensions in the hexagon. You might be thinking about supports or evidence, capacity, usability, or fit. So I'm just curious if you can use the chat box to respond to this question about centering equity when you're selecting interventions. As we talk about how the hexagon has been revised, I think this will be a nice lead in. So let's see what we have here. Involving the populations in the planning process of selection, nothing about us without us. Absolutely, the importance of involving those that are most impacted, right? Thank you for that. Considering the degree of user involvement. Oh, consider the degree of user involvement in the development and testing of interventions. Similarly, making sure we're thinking about the population that's going to be served. Include those impacted by inequity in all stages of the process, including the identification of need, selection of the intervention, and implementation and study. Stakeholder collaboration is critical thoughts and feedback should inform the work. Use evidence to consider what the root cause is. Ooh, it's moving so quickly now. I lost my blaze, sorry. Oh my goodness, it's jumping. Use evidence to consider the root causes and what similar interventions have worked or not worked in the past. Look at the research studies and subgroups or populations where the evidence is generated from. Did they have a diverse group who was included in the study? Have evidence about which cultural groups and intervention is proven with and for. Let's see, there's a question here for Maria about the number of programs that we've rated so far. Marita, do you have a quick response to that, or approximate of how many programs?
So how many programs have you? And I would be curious also, just to pick up with Christine, is did you have any of the considerations that were mentioned here when you were going through your different interventions? Just briefly.
So at the moment, sorry? No, I'm not on mute. Hello. At the moment, so we're only partway through. So the resource isn't fully populated at the moment, and so we've currently got around 70 programs in there, and we expect that there'll probably be about another 40 or 50 more to go in there. Within that, though, the programs, as you could see briefly in the demonstration, the programs have different evidence. So some of the programs will just be relevant for one age group, whereas others span across multiple age groups. So even though we might have looked at one program in relation to preschoolers, for example, it might be a program that's relevant across a wider age range of children.
And Marita, maybe it might just be good, because you talked about this in the beginning, but as I'm thinking about what's coming into the chat, the extent, just mentioning again that the scoring of the programs actually went back out to practitioners to get a sense of, would they agree that this has been their experience delivering the program, and that we're also in the midst of planning to gather feedback about the resource from individuals with lived experience.
Yeah, absolutely. And so one of the things that we wanted to do to get more, data about how reliable and valid the scoring was to share it with practitioners who were not just practitioners, but also the services that were implementing the interventions, to get their feedback. So we would send out the descriptor, so not the score, but the descriptor of what the score meant, and get feedback about whether that was their experience. So when we're talking about, the support, so we're talking about the usability, did that sort of, the level that we were saying that was rated for that program, did that have resonance for them? Was that their experience of it? So that's been really helpful to get that feedback from stakeholders, and what we've found is actually really high concurrence with what we've put as the score, that has been the experience of others, which has been really helpful for us. And as Alison mentioned, what we're working with our stakeholder group, and this is the value of having a stakeholder group, especially having our colleagues who work in the voluntary sector, who have really strong relationships with families, that we're working with them to look at how we can best engage those with lived experience to get their feedback about the resource, which we're really excited about that will be happening soon.
Marita, I have one more question for you, and I promise I'll move us on after this one. What if the program is new and was developed by a more community-based group that didn't have the same resources as larger models? Is that why they didn't lead with evidence?
So you're saying if it was a program that didn't have much evidence? Well, and that's precisely the point of why we didn't want to just make this evidence, one, because we didn't want people to just default back to what they've done before, but two, what we wanted to do was to open this up, that there could be locally developed programs that have, and so our minimum criteria for evidence is that there has to be a theory of change. There has to be a model of what would be the expected mechanism that's going to bring about impact of change. So yeah, certainly what we have is that not all of the programs have, research evidence, not all of the programs have even evaluations about them, but we felt it was really important that as long as there was a theory behind one of the programs that had been developed, that we could include those so that we could broaden the scope away from just it being quite a narrow focus. And I think that that's been really well appreciated by the stakeholder group as well. They felt quite strongly about that, and so we're pleased to be able to include that.
Thank you for that, Marita. I'm just seeing in the chat how many people are so enthused by this tool. So it's amazing. Thank you for your presentation. I'm going to pass the mic back to Allison to lead us to our next presenter.
That's great. Thank you so much, Christine and Rita and Judy. Well done. We are so thrilled. I actually think this is the first really big kind of presentation of this. I know there was supposed to be a major launch of this in Scotland in June, but with the pandemic, there's just been some quieter, softer launches. And part of that's also because, as you noted, Marita, it's not fully populated yet. So there's a lot of still kind of testing going on with the site. But this multi-year effort to have the resource be, as you noted, have so many bespoke components to it, so that communities can really ask the right questions for themselves. It's really an amazing piece of work. Thank you so much. The question that Christine asked that kind of led us into that chat was, how do we center equity when we're selecting interventions? And just want to note that that is something that NIRN, the National Implementation Research Network, has been grappling with ourselves. There were some questions, I think, asking for this revised hexagon. So Laura Lewison, an associate director with NIRN, and my partner in revising this hexagon for the millionth time, is going to just lead us through some of the changes that we've made there to center equity. But also, I had asked that question about how many programs we've reviewed, because the scoring has gone through extensive usability testing because of our Scottish colleagues. So this has been kind of an amazing back and forth. Their use of it has taught us a tremendous amount about how to make this easy for folks. And so the scoring looks different. So you'll see in the chat, at least twice, I think I popped in the link to the September 2020 version of the hexagon. I'm going to go ahead and share my screen one more time and hope that this goes well. And we've done our Q&A, we've done our discussion. And Laura, I think this is your first slide, right?
It is.
Okay, so I'm going to pass it off to Laura. Thanks, everyone.
Thanks, Allison. And thank you, Judy and Marita. It's so exciting to hear about where that work has gone. And I'm excited to be able to provide an update about some of the revisions that we have made at NIRN to the hexagon tool that Judy and Marita have used as the basis for their resource in Scotland. We had a number of questions in the chat box that asked for more information about the tool. So I'm going to start by just providing a very brief overview of the tool, which is a resource that was originally developed by colleagues at the University of Maryland that NIRN, the National Implementation Research Network, has taken and really refined, I would say, over now many years of use. We had a revision that came out originally in 2018, and then most recently this version this past September. The hexagon tool is an assessment tool that can help organizations or implementing agencies evaluate the fit and feasibility of a program or a practice in a specific context. So as in that beautiful example that Marita showed us, if you have a rural community that is thinking about implementing an intervention or a program or practice that will help strengthen families and caregivers' support for infant mental health, then thinking about both what are the community needs and capacity, and how does that align with or disconnect from a specific program or practice that's been developed. And so the hexagon tool uses 6 domains. This hexagon shape probably looks familiar after Marita's presentation, that can help assess the need, the evidence, and the potential fit of a program or practice. And then how use, the need, the use, I am used to looking at the hexagon in the opposite order. So one of the things you'll see is that we've revised the order of our categories. It allows us to look at need, fit, and capacity for a community, a context where something will be implemented, and to hold that up against the evidence and usability and supports available for a particular program or practice. And so it's designed to be used as a team to facilitate discussion with scoring, and then ensure that a really comprehensive or holistic assessment of that fit and feasibility is done. We can move to the next slide, Allison. So as Allison mentioned, we've gotten a ton of feedback on usability of the tool over the past several years, both from the testing that was done in Scotland that helped us refine our scoring rubrics, and from usability testing at NERN. But today I'm going to be primarily showcasing some of the most recent revisions that have been done to center race equity in this tool and how it can be used to further conversations around centering equity in the context of implementation. I want to acknowledge 2 key partners who have really helped us accomplish this work. We could not have done it without them. The Annie Casey Foundation and Just Partners, who provided sort of relentless and fearless guidance in thinking about how we might shift this tool to better center equity. And those revisions were long overdue. Historically, the hexagon could be used to further those conversations, but it was very dependent on the facilitator's skill and ability and the facilitator's own understanding of race and diversity or inclusion questions. And so what we hope to do in this most recent revision is center those questions. And so many of the suggestions that folks had shared in the chat box, I hope you'll see some of those here in this most recent revision. We know that assessment of fit and feasibility is really inextricably linked to considerations of diversity and equity and inclusion. And we can't think about the disparities in outcomes that we see in communities without confronting histories of structural racism and marginalization. And our hope is that this revised version of the hexagon tool can be used to prompt teams to consider programs and communities through that race equity lens. So you'll see a number of revisions that are throughout the new tool, changes around language, around how we talk about the communities that may be served, around how we define things like diverse perspectives when we're talking about who might be included in a team. You'll also see that for the first time, the hexagon now includes specific best practices for centering equity in the use of the tool, starting with the idea that the community partners and stakeholders and the focus population, the population whom you're hoping to serve with the program or practice, need to be engaged as equal team members. So someone said in the chat, this idea about nothing about us without us, and that is our hope, that the hexagon tool will be used with that in mind. We also provide guidance that the team who's working through the hexagon domains and having these discussions should have a foundational knowledge about racism and inequity as it relates to the community that they will be working in. And then finally, and there were a number of mentions about this in the chat as well, the idea that this tool relies on assessment of need and assessment of evidence, and that we can't do that without thinking about how that data needs to be disaggregated, that we need to be looking at program data, at fidelity data, at outcome data with as much nuance as we can. So we're really able to assess the potential benefits or challenges of implementing something with an idea that it's not a one size fits all, that there are population specific needs. We made changes to all of the indicators. So if you are following along at home with your most recent version of the hexagon, and you're a keen observer, you may notice changes in each indicator. But I'm just going to focus on 3 because I think these are 3 that are, for me, particularly significant. And also they nicely align with some of the comments we had in the chat as well. The first is in how we consider evidence. And so the hexagon tool prompts the team reviewing fit and feasibility to think about who this evidence was created with and what outcomes for whom. We have shifted the indicators and the rating scale in the evidence domain. So shifted the questions, let me say that, shifted the questions and the rating scale in the evidence domain to better consider community-driven evidence. So as I think there was a question about the tool that Marita was showcasing, thinking about interventions that may have been developed in a community by community practitioners, but maybe have not gone through a randomized control trial yet. So we have shifted these to really lift up the importance of practice-based evidence and community-driven evidence, emerging practices that might be more responsive to different populations, and ensuring that that's considered when people are assessing and scoring. The next indicator that I want to showcase is the one around fit. And so this is an area where we're asking questions about how does this program or practice align with the context where we'll be implementing. If we are considering a program that will provide sex education, are we thinking about what a community has done historically around this topic, or what a community's values and mindset might be? What will the impact of this program or practice be on other initiatives or on community conversations? We've shifted the questions here so that we are thinking about how a program or practice might fit with a community history or disrupt it, right? Because sometimes that is what we're hoping to achieve in a community that has a strong history of oppression or marginalization, and what the potential impacts of that fit or that disruption are. And then the final domain that I want to showcase, Allison, thanks, is the one around capacity. And someone in the chat, I think it was maybe Nancy, highlighted this idea that sometimes we have community organizations who might be implementing that don't have a ton of capacity, but that's not necessarily a bad thing, right? It's something we want to be aware of. And the questions in this domain seek to identify different aspects of that capacity, thinking not just about, do you have qualified staff, but do you have staff who are from the community that they'll be working in, and who have some congruence with the populations that they'll be serving, so that you are not just emphasizing education or credentialing, although that is important, of course, but also thinking about how that capacity that you're looking for lifts up a community's strengths and can best meet the needs of a population. The final thing I want to share is that we have an additional resource that speaks to the emphasis for stakeholder engagement in the tool that we are trying to really lift up. And so this is a resource, a great resource that comes from our colleagues at the Collective Impact Forum and Leading Inside Out, that helps map out who is at the table for the discussion and who you might want to bring in and ensure is included. So I will pause there. We're a little bit over time, and I'm sure we have questions. And we are happy to speak to any of the revisions that were made or how the tool might be used.
Thank you, Laura, for going through those slides. I'm sorry that you might have felt rushed, but it was really helpful to see the adaptations that have been made and how thoughtful NERN has been in working with partners to think about equity as they make those changes to the model. I do have one question in chat. I think we probably only have time for one question. And you started to address this as you were talking about capacity, agency capacity. So I'll read the question from the chat from Chelsea Haley. It says, did you think about how smaller, more community-based organizations that may be BIPOC, Black, Indigenous, people of color run and serve the most disadvantaged populations, how they may be overburdened in rigorously documenting outcomes, or how meaningful in-depth community work with small sample sizes may be seen as less scalable? That's a lot. Did you get all of that, Laura?
I think so. That is a lot, right?
Yeah, thinking about how smaller community-based organizations might be overburdened in having to rigorously document outcomes.
Yeah, and I feel like this hits on two of the hexagon domains for me, right? How do we think about evidence? What evidence do we value? And how do we ensure that creation of evidence isn't taking up space that needs to be there for serving people and communities. And then this other question around how do we understand capacity if we're not just thinking about, do you file all your taxes properly? Do you have an audit that's recent so that we can make a grant to you? I hope that some of the revisions in this tool can speak to both of those needs. So in the evidence domain, we've tried to do the work of lifting up community-based, practice-based evidence. Marita spoke to this idea of you might not have a lot of evidence, but do you have a logic model? Can you talk us through what we believe are the relationships between core components? And we're hopeful that that provides some space for thinking about different understandings or different definitions of evidence. The capacity question, I think, is a really hard one because small community-based organizations are always under-resourced and always overburdened inherently. And because of the way we think about funding and supporting services. And so I think that we don't speak to that issue specifically in the tool. And I think it's a great question. In our revision, we get at questions like, does the implementing agency have staff that can meet the program's requirements? Do they have a cultural and language match with the population they serve? Do they have relationships in the community? Do they do they have the resources? Do they know how much it costs? Probably what I would describe as more technical questions. And what you're lifting up as an adaptive issue around how do we measure this question of burden and how do we address it from a funding perspective or a technical assistance perspective? And I think that's really, really insightful, and we should think about how we're measuring that in this assessment.
Mm-hmm.
I'll stop there, Christine.
Oh, that's great. I think that makes so much sense, Laura. And I think the big takeaway from this is with those 6 domains, you can have high scores on things like evidence. But you can have low scores on things like capacity, like this would be hard for us to pull off. And so you may want to be relying on where you have higher scores around fit and need. This is a good fit for us. It meets our need. But as Laura notes, it's a larger conversation, I think, for the field and for funders and community partners in terms of making those choices. There's the hexagon. I think Marita said, when you fill out all those numbers, we don't just say, this is the program you should choose. It's really food for thought. And it's why that stakeholder engagement tool that Laura shared is so important. We had some questions about those resources. I wanted to share again that the hexagon is, the new one is up and folks are able to download that in the full discussion guide. Not all of the accompanying resources for that are up on our website, including the stakeholder engagement tool that Laura shared. We will post those on the event website though, and find a way to get you all of that. So we're really happy to do that. Just in our final moments, we just wanted to remind you that this session will be recorded and posted on the event website, also cross-posted on the NERN website. So you will have an ability to listen to this over and over again and to share it with your friends. So we're happy for that. There is a quick evaluation that we hope folks will complete. Todd will have to tell me where that is. I think we might have a link coming up about that. Again, if you want to tweet about the event, please use the hashtag. Thank you. Todd has put the quick evaluation. We mean quick. We're a very low burden group, hopefully. If you can click on that link in the chat. These slides will be available on the website, so you'll see that you can access all of these resources that were talked about. And I would be remiss if I did not give important information out there that we are continuing our fall series on December 4th, also starting at 10 a.m. Eastern time, or this started at 10:30 today. On December 4th, we will actually go a little bit longer. We will have a short break in the middle, but it'll be from 10 a.m. Eastern time to 12 noon. We apologize to our West Coast colleagues for these 10 a.m. start times, but it's so we can accommodate our European colleagues. So we have a lot of time zones that we try and straddle. And this will be on the critical role of relationships and implementation practice. We have some amazing findings on that we'd like to share with folks. And also we will be releasing a new international practice guide to supporting implementation, and that is in collaboration with the Center for Effective Services based in Ireland and the European Implementation Collaborative. It's actually an extension of things we talked about in June, the competencies for implementation support practitioners. We have more information to share on that, and this new guide that will literally be hot off the presses and ready for release just before the December 4th date. We have an incredible lineup for that event, so please go to our website and you'll see we have about 8 or 10 speakers lined up for that, and will all be about implementation practice. So, and we have more events underway in 2021 that we'll be sharing with you. I think we made it. It's exactly noon Eastern time. Sarah, have I missed anything? No.
You got it all. Thank you again to our wonderful speakers and to everyone for joining us today.
Thank you so much. And if our speakers want to stay on for just a moment when everyone is hopping off, that would be wonderful. But thank you to everybody.